Heroes of Infection Prevention Award honors infection preventionists who have successfully reduced infection, raised awareness, and improved the health and well-being of patients, healthcare workers, and the public. Supported by a grant from BD, an APIC strategic partner, the program has recognized more than 100 individuals and groups for their exceptional work in reducing healthcare-associated infections. It is an honor to recognize the following as 2017 Heroes of Infection Prevention. In 2013, blood and body fluid injuries were the #1 OSHA-preventable injury at Mary Jo Belush's facility. Leveraging lean methodology, Mary Jo identified that 95% of these injuries were caused by employees rushing through tasks, not always following proper procedures, and misusing safety devices.
We chose Mary Jo because she had a lot of strengths and they were able to actually standardize their process. She was very proactive in their percentage of injuries that were occurring in her facility, so they were able to decrease by almost 50%, which was extremely successful for her and her program.
Katie Carey transitioned to infection prevention and control from a career in microbiology because she wanted to become more involved with the complete spectrum of patient care.
Katie took the initiative to look at her bloodstream infection rate in bone marrow transplant patients. She was an early adopter of alcohol-impregnated caps, which helped decrease the bloodstream infections in her facility.
Katie advises other IPs who want to innovate to be brave and be visible. She also emphasizes building relationships to gain support. The Dignity Health Infection Prevention Team has systematically built an infection prevention and control structure that supports improved patient outcomes in 39 facilities across 3 states.
We chose Dignity Health because of their system approach. Despite the geography differences, they were able to standardize a lot of their processes to meet CMS guidelines.
Participation in the CMS Partnership for Patients Hospital Engagement Networks gave the Dignity Health team additional support and helped to bring about a 40% reduction in the system's CAUTI and CLABSI rates. After launching a pilot infection prevention program for the state of New Mexico, Christina Ewers decided to make the switch from public health to infection prevention because she wanted to be able to impact patient health.
Well, Christina took the initiative and used a system approach to look at her infections, including central line-associated bloodstream infections, urinary tract infections, and C. difficile infections.
She finds this approach beneficial because it focuses on the system and processes versus individual failures. Christina serves on the board for APIC Mile High Chapter 22 and emphasizes the importance of APIC involvement for anyone in an infection prevention role. Angela Rupp and Elaine Whaley. In February 2016, Elaine Whaley's Texas-based pediatric hospital identified a cluster of Burkholderia cepacia among their pediatric non-cystic fibrosis patients. Just a few weeks later, Angela Rupp's Chicago pediatric facility identified a similar cluster.
We chose Angela and Elaine because they came from 2 different facilities, 2 different states. They're from a pediatric hospital. Both were having issues with Burkholderia cepacia. They were able to collaborate together, share their data information, and eliminate their Burkholderia cepacia problem.
By comparing supplies and medications used at their facilities, they identified a common contaminated product. Their findings resulted in an FDA recall, preventing countless infections. Jamie Swift's problem-solving capabilities, as well as her leadership, influence, and tenacity, have had a significant positive impact on the health and safety of her Tennessee community. In 2014 and 2015, she spearheaded an effort that earned her health system the first Tennessee Highly Infectious Disease Treatment Network designation.
Jamie Swift took the initiative, and she looked at Ebola, and she worked with 13 different hospitals. And in that process, she identified a system that could rapidly identify, segregate, and treat a patient with Ebola.
Swift's leadership has also resulted in the development of sustained community prevention and response programs addressing measles, Zika, and the flu. The HEROES Implementation Research Scholar Award program supports research that advances implementation science, demonstrating the value of infection prevention and quality efforts across clinical settings. Introduced in 2011, the program is supported by a grant from BD, an APIC strategic partner. We are honored to announce 2 recipients. The first is Dr. Eileen Carter of the Columbia University School of Nursing. Dr. Carter's proposal is titled Exploring the Nurse's Role in Antimicrobial Stewardship, a multi-site qualitative study.
Dr. Carter's proposal is highly innovative and it addresses a critically important topic for infection preventionists. That is the use of antibiotics and antibiotic stewardship.
Congratulations, Dr. Carter. Our second recipient is Dr. Misha Huang of the Denver-Seattle Center of Innovation, Department of Veterans Affairs. Dr. Huang's proposal is titled Barriers and Facilitators of Procalcitonin Implementation to Guide Antibiotic Use.
Dr. Huang brought a very interdisciplinary team that's going to help guide antibiotic use and answer another important topic for infection prevention.
Please join us in congratulating Dr. Huang. We salute our heroes and our HEROES Implementation Research Scholar Award recipients, and we thank them for their innovative patient safety work.